Hi, welcome to the BariNation podcast, where we support the bariatric community with humor, humility, and honesty. I'm April.
I'm Jason.
I'm Natalie.
And if you're watching, you can see who our amazing guest is today. It's friend, expert, bariatric patient extraordinaire, Sarah Smith.
Hello, everyone.
We are so excited to talk to you today. Nat's going to go into a little detail about why, but we want to make sure that we kind of start maybe revisiting why we're so passionate about supporting this community. All four of us on the screen are bariatric patients, and we have come to know that there are three pillars in our bariatric journey. And if we live these pillars, we will be successful. And those pillars are movement, mindset, and metabolic wellness. And our topic today has everything to do with kind of all three pillars. It's kind of this big overarching support that covers all of these pillars, if you will. So yeah, Nat, you want to explain what we're talking about?
Absolutely. So for the season that we are in currently, which is spring, even though it doesn't feel like it in some areas of the world, we are working on, just how to spring forward. How to spring forward towards our goals, how to spring forward out of maybe you had kind of a winter funk and you want to get out of that. So for the months of April, May, June, we're just going to be talking about how we can spring forward, get back to our basics, and get to our bariatric goals. So peer support actually is a fantastic way to do that. And we'll get into that later.
Yeah. I say we just dive in. Ready?
Let's do it.
Let's do it.
Good. Do it.
Let's do it. So, Sarah, will you please take a moment and introduce yourself to any of our friends, followers, or watchers that maybe have never met you before?
Sure, I will. My name is Sarah Smith. I am a therapist. I live here in Jacksonville, Florida. I'm a licensed alcohol and drug counselor in the state of Oklahoma. So I have been in the field working with people in addiction and recovery for almost 15 years now. Yeah, I hate to say that because then you figure out how old I am. But prior to that, I got my start while I was an undergrad doing my internship at a recovery community organization. And what that is, it's an organization that is everyone that works there from the front door to the back door were all people that were in recovery. So it was actually the first peer-driven, peer-led recovery community organization in the state of Oklahoma for people with addictive disorders. And that is really where I fell in love with the power of peer support. I got a lot of encouragement in my own recovery journey, as well as the ability to move past the things that I'd experienced in my life and really realize that part of my experiences were what helped me be able to relate to the individuals that I work with as a therapist. And really bringing forth the power of that story into helping other people, find their own recovery or move forward in their own lives. I know when you guys were starting BariNation and you were really talking about what you wanted to do, I'm hearing it and I'm like, wait, that's peer support. That's what you're talking. That's what I do, you guys. So I was so excited. That you figured out a way to bring this power to the bariatric community. And so that's why I'm here to talk about it, because it's exciting for me.
Yeah. Well, it's been a passion of yours for so long, and you are so skilled at it from the therapist viewpoint, from just like the leader of peer support viewpoint, and now from a patient perspective, right? So you are really an expert in this peer-led support from so many facets of your life. It brings a point of view and a perspective that we just wouldn't have had we not known you. So yeah. And I think we also have to have full disclosure here. Sarah is also Jason's wife, and Godspeed to her. Like, you haven't murdered him yet. He's still alive and well. Like, wow.
Yeah, I'm surprised she didn't get there. There should have been an award for her at Just Be You specifically for that. for putting up with me, because we're about
Yeah.
to celebrate our 23rd wedding anniversary.
Holy cow.
Been together 24, married 23. So yeah, 3 kids and 3 grandkids later, and she's still putting up with me.
So I got to ask, because I ask a lot of people that have made it a long time married, right? Because this is, not to say it's rare, but it's not as common now. What would you say is one of the things that has kept it going?
The biggest thing was we learned how to fight fair. We had a very big problem early on with talking about kind of everything except what the initial problem was at the time. And it took us a long time to kind of get to the point that we figured out, in order to get, like, what's done is done, what's past is past. If we're over it today, let's just be over it. Start fresh, start here, go forward, and everything we have from this point on. If it's an immediate problem, we talk about it right then. We don't let it build up. We don't let it fester. We get it out of the way. And if it's a negotiable, we negotiate it. If it's a non-negotiable, then we figure out how to deal with it and move on. And that was probably the biggest thing, aside from her, training me on how not to be a jackass for the last 24 years, because trust me, it's been hard. I have not made it easy on this woman at all. So she deserves all the praise, all the medals, all the things, because I was a piece of work. So the man you see before you that you know and love today is not the man that I was when I was 24 when I met her. I promise you that.
Sarah, what about you? What would you say is the biggest thing?
I was definitely going to say communication as well. So yeah, and fighting fair, it's actually, it's a technique. I feel like we were fairly fortunate. I know people don't like to do this, but we went to premarital counseling. I know a lot of people think that's stupid or whatever, but I remember in, the first year we were arguing and I like ran in the other room and got the binder and like, you're doing it wrong. Like, here are the things, because and I think it's something that we all figure out, like, as we're getting to know ourselves better and then getting to know our partners as well. But, one of the things Jason does is if it's an area where he's already feeling kind of like insecure or sort of beating himself up about something, and it is also something that is bothering me, if I mention it, he will then get mad at me and said, well, you're saying, and then give me this laundry list of stuff. And I'm turning around like, I didn't say any of that. How did you hear that? And so, like, over time, we've figured out that's the stuff he's telling himself because he already felt bad about it or whatever. And so that gave you a lot of techniques to go back through and say, when you do this, I feel this, not you make me feel, but I feel it. This is how I feel. I'm owning my own feelings. And what I need from you is, X, Y, Z, whatever the thing is. And really being able to separate feelings and actions and having those conversations. And I think that is the communication probably is the biggest part that's kept it going, because we don't get along all the time. Everybody's like, oh, y'all are so cute couple. Like, no, there's days.
That night I've seen some of those days. We have been privy to that, and it's like when Sarah is not having it, she's just like, he's acting a fool and I'm not having any of it, but you know what, like, he's your problem now. And it's like, God damn, really? Okay, fine. Like,
she'll pass me off quick.
Call it April.
She will pass me off real quick.
Yeah.
Oh God. Man. Well, thank you for answering that. This is not the topic at all, but I just love to highlight that. I mean, it is, but it isn't. It's a little,
Yes. Well, but what I was thinking as you were talking about, communication in your relationship, I too learned the magic sentence very early in my life, right? When you do this, I feel this. Super powerful phrase.
Mhm.
If we don't have that skill, or if the person who we are trying to get support from isn't supporting us in the way that we need, both physically, emotionally, right? If they can sympathize but not empathize, there is going to be a disconnect along our bariatric journey, because we're going to feel like we're talking to a wall, or we're going to feel that we're not going to feel comfortable maybe disclosing everything that we really want to say, because we're worried that this person might judge us. Right. So if you don't have that person or that group to go to have these conversations and to get these emotions out and to ask your questions, you're going to be stymied. I mean, you're going to be stuck.
Mhm.
Because what we always say is that obesity as a disease is isolating, right? It is a very isolating disease. And if we want to fight back against that isolation, we have to find a supportive community, right? That is the opposite. We're going to fight the disease with the opposite of what it kind of does to our lives. So if obesity is isolating, we're going to fight the isolation with community. And this peer-led support, I think, was something that was missing from so many of our lives, really when we made the decision to have surgery. And we're seeing the powerful impact that peer-led support has had, not only on our own journeys, but the journeys of thousands of people in our community. Mm-hmm. Right. So the goal of the conversation today is really to get a better understanding of what peer support is, and why it can be so powerful. And then we're each going to kind of share, the positive impacts that it's made in our own journey, because that's important, right? It's important to know what it is, but really it's important to know how we each have utilized it in a very different way to move through our journey.
Yeah. Mm-hmm. And I think it's really important to know, like, peer support in bariatric surgery, like BariNation, like this whole concept. Yes, this is new. It's a little, it's not even 2 years old yet. We're a little baby peer supporter in the bariatric world here. But I think, peer support has been around for a very long time. So like there's people that, research the histories of things. And I enjoy reading that because I'm a crazy person, I'll admit it. But I mean, there's references to the power of peer support dating all the way back to the 18th century, starting in France. Anybody that's familiar with like 12-step programs, AA, NA, if you know the story about AA, Dr. Bob, Bill Smith had a conversation. They figured out that that's what kept them sober. AA was born out of that in the 1930s, 1935 actually. But that was peer-to-peer conversation, an alcoholic talking to another alcoholic, and that helped them stay on their journey or on their trajectory. It really expanded into the area of mental health and psychiatric care in the 60s. That's continued to span in the 80s, where recovery community organizations and things like that started. It got out of the hospital and into the community around that. Over the last, I would say, 20 years, it's really expanded into healthcare, which is where we are now. It started with people with serious like that had like transplants, traumatic brain injuries, like serious like health conditions there. And then now, even more recently, especially coming out of COVID, we're really starting to see peer support getting pushed into like worksite wellness. So we're doing self-care at work, wellness at work, and how you're putting employees together to go through that journey. But all of that is peer support. When you take two people that have a similar experience and you put them together to share that experience, strength, and hope, that's all it is.
Experience, strength, and hope. That's peer support.
Mm-hmm.
Wow, that's powerful.
Well, for some reason, I was thinking it was, I guess I knew what it was because I felt that I had been doing it for some time, but I never put those three things together. And really, that is what we get when we share our experience with one another, right? It is a sense of hope. And it's a sense of not being so alone. And it's a sense of being seen and heard and validated. And it's, for me, it's also a place where somebody can check me in a kind way, right? Like, that's interesting, but have you thought about it from this perspective? Or like, you're crazy, here's why. But like, oh my God. Okay. So what were the words again? Peer support.
Experience, strength, and hope.
Experience, strength, and hope.
Mm-hmm.
Okay. Experience, strength, and hope.
Mm-hmm. I think it's really important too to know that peer support is not replacing anything. It's complementing, it's expanding, it's adding to. So it's not a replacement for therapy. I know if you're a member of BariNation, even those of us that are therapists that are there leading support groups, like I'm doing that as a peer. And I will say, have you talked to your therapist about that? Like you, you get, guided back to whatever that professional is. If somebody's talking about, their diet or their meal plan, we will ask them, have you talked to your dietitian? Have you talked to your surgeon? So it's not that, as peers, we're not seeking to replace any of those services that are there. We're definitely seeking to complement them. And that's part of where that strength piece comes in, because if you're saying like, oh, I'm experiencing regain and I don't want to make my appointment and go to my surgeon, I just don't want them to say that I'm a failure. That's where you can say, well, I experienced regain. And going to see my surgeon and talking to them about it was the most important thing for me. Or I experienced regain and going to see my dietitian and looking at my meal plan was the most important thing for me to overcome it.
It's another adjunct treatment. The same thing as all the other adjunct treatments that we talk about, whether it be therapy, whether it be, weight loss medications or maintenance meds or whatever that may be. The adjunct treatments come in all shapes and sizes, and we've come to find out that peer support absolutely is, an adjunct treatment that we need.
Yeah, absolutely.
I mean, there's no way I could have gotten where I am today without the three of you on the screen. Absolutely not. And when I was really thinking about this conversation this weekend and even last night, I realized I have so many layers of peer support that I have had to curate, right, over my almost 4 years. But those different layers provide very different types of support in very different scenarios. Mm-hmm. And one of the spark moments in my life to even create the first VBM where I met Jason was because I only had one other person in my life that I could go to ask my bariatric questions, right? And to vent, or just to like, one other person was a woman that inspired me to have surgery. I call her she was my Bari angel. But I realized that I was relying on her hours every single day. And I just thought, this is not sustainable. This is not sustainable. Like, she's going to get so sick of me and I'm going to get so sick of her. And this is just not fair. And when I started to look around for a community that I could become a part of, it either didn't exist or it wasn't right for the bariatric experience. It just didn't exist. But I knew that there was power in bringing those people together because I had done it in kind of other facets of my life, but never in the bariatric realm. So, Sarah, what does the research say? Why is peer support such a powerful element in our journey?
Well, I think it really just lets you know that you're not alone. It was like you said, April, this is a very isolating disease. And so just having that epiphany, those aha moments, where you just realize this is not just me, this is we. And then so you're learning, then together we can overcome these things. I know that was a huge takeaway in my group. So, I'm a therapist and I work with individuals that are, receiving substance use disorder treatment. They're recovering from addictions. And, tonight, one of the individuals was sharing, and he was really struggling by seeing someone show up that was under the influence. So, he's in recovery for a while, sees somebody else that's visibly under the influence, and it just brought up all of this rage in him. And so he was sharing about that, but thinking it's just him. And it was really just being confronted with that used to be me. So it's kind of that same reaction we get when we see a really obese person that's struggling to walk or struggling to get around. I know Jason and I have talked about that a lot. Like, you almost want to run up to these strangers on the street and just say, you know, let me tell you about bariatric surgery. Come with me. I'm going to drag you to a center of excellence right now. But you know, he was sharing that about seeing this person that was under the influence. And of course, everybody in the group, at the end of the group, when we're closing out, their key takeaway was, it's not just me. I'm not alone. Like, they all related to that feeling that he was sharing in that group. And it's the same thing that we do as bariatric patients when we experience those moments. Like, why do you get so frustrated, you know, seeing obese people that are still challenged every day to live their lives, or they're struggling at work, or they're struggling in their relationships? And, you know, it's like, we just know a better way.
Because I remember what it was like to be there. I remember when I see people walking and having a hard time. It's frustrating to a point, but it just hurts me to see somebody else struggle in the way that I know I did, because I know what that feels like. I know every step when it's excruciating, and how your ankles feel, and how his knees feel, and how their hips feel, and how their back feels. Like, I go through, it takes me immediately back to where I was when I was that same size or bigger. And I know, like, because now that I know what it's like to be on the other side, I'm just like, oh, Jesus. Same thing when you see people that are pre-op and they're just like, oh, I'm a little nervous. I don't know what it's going to be like on the other side. And I'm like, oh my God, it's amazing on the other side. Like, I can't tell you, I can't begin to sing the praises of how great it is once you get on the other side, because it's just, we just know, and it does.
Yeah.
It's so hard not to. We say that, we joke that we're the Bari evangelicals, because we just want to, like, go up and shake people and be like, we know that there's a better way. And it is hard, but I think where I feel fulfilled and like I am on the right track is when I do talk to, you know, the three of you. I go to BariNation support groups. I can go to my Instagram, and just knowing that those resources and those people are out there. I mean, I didn't have that. My first surgery was in 2009. I mean, Instagram wasn't even created at that point. But there were no support groups. There were no, like, real educational resources with, you know, true, real education, or with peers that had gone through it, who were my age, who looked like me. You know, there's all those other factors too. And so when I finally decided to have my most recent surgery, and I looked on Instagram, it was like, holy cow, like, so many people have bariatric surgery, and so many people are talking about the same experiences. And it's just that, Sarah, like, I felt seen and heard and validated just in one moment, which is incredible.
Yeah. And I think it's amazing too, because it's having those, because people that didn't have surgery, or especially people that were not, you know, as heavy as some of us were. Like, my highest weight, I was almost 400 pounds. So it's very easy for people that weren't there to just go, oh, but you're not there anymore. Like, I don't understand why but you're fine. Like, I don't understand why you're getting so emotional about this, or so angry about, or so upset, you know, whatever the feeling is. I don't understand why you're having the feeling, because you're not that person anymore. And it's very difficult if you haven't been there to understand that. It was one of the things, and I actually have experienced it multiple times because of all of the recoveries I have experienced in my life. But it was the same thing, like, even with, you know, and if you haven't listened to me on any other BariNation podcast, but I'm also do have a history of substance use that I talk about there. But I remember when I first started working for a recovery community organization, you know, my mom said to me, Are you sure you want to do that? Because everyone knows that everyone that works there, you know, is in recovery or has had a problem. Are you sure you want to label yourself that way? And I was like, well, of course I want to label I mean, it is what it is. This is what I, you know, this is what I am. But it was kind of that, you'll get that from people. Like, you're not obese anymore. Are you sure you want to put that label out there? You're not using drugs anymore. Are you sure you want to put that label out there? So it's very difficult when you have these other supporters that don't really understand why it's so important to us to tell our story, or why it's so important to us to support other people on their journeys.
Dude,
oh, sorry, April.
She's making the face.
I know she's having a moment. I struggle, as do I think all of us, when people say, well, you're not obese anymore, you're not an addict anymore. Obesity and addiction are lifelong. Obesity is a lifelong disease. Addiction is a lifelong mental battle. I have obesity. I will always be that person that I was at 400 pounds. Those feelings and thoughts still run through my brain, even though I'm 140 pounds lighter. And so I struggle, and I know all of us do, but I struggle so hard when people say, like, oh, are you sure you want to talk about this? Yes, because it's my life. Like, I am so encompassed by, I mean, I'm so much more than my obesity and my bariatric surgery, but at the same time, everything I do today is because I was obese and because I had surgery. So the two are not exclusive. I will always have obesity. I will always be a bariatric patient. It's not just one and done.
Yeah.
no. Oh no, dude, my mind, I'm like, I think my brain just literally split in 2 or 4, because it is just like, oh my God. The reason for me that it is so important that I continue to tell my story, even though I don't look like an obese person anymore, is that if I don't stay connected with my disease is going to run ramshot over me. It is going to absolutely, right? I'm going to be like, oh, I don't have it anymore. Like, oh, it's no big deal, right? By me not talking about it, it's putting some distance between me and my disease. And when I get distance between the disease, it sits over there and it makes its own new plan to just come and absolutely railroad me. And it will blindside me when I give it distance. But by telling my story, I am making out with that thing. Like, you know what I mean? Like, it can't go anywhere, and I can keep my eyes on it, and I can understand what it's doing. And when I see it trying to get sneaky and try something new, nope. Like, bitch, I see what you're doing. I am right here. And if you don't tell your story, if you do not stay connected to your disease, which sounds freaking bizarre, it gonna come for you.
Well, and it's crazy that we have to even answer the question as to what made you want to tell your story. Like, A, because I'm proud as hell of what I've been through, what I've gone through, and where I'm at now. B, I know what it's like to look out there and not know if something's going to work for me. And I know what it takes to find somebody to finally get to the point where you can see if it's going to work for you. So I wanted to be that for the next person, so that the next person didn't feel as left behind, or that they had to scour the internet as long as they did to find somebody to know if it was going to work or not. So it was wild to me that when somebody asked me that from the get-go, they're like, we haven't had surgery yet. Why are you talking about it? Like, I'm like, because I'm excited. Like, this shit's going to save my life. What do you mean? Why am I excited? Like, why am I talking about it? Like, why wouldn't I talk about it? Like, I'm shouting this shit from the rooftops. Like, what do you mean? Like, I was all about it from the jump. Like, I was super excited.
For anyone not watching right now, I need you to stop, pause, go to YouTube, BariNation, just search us on YouTube, go to this episode and continue watching, because April has something to say.
Dude, I am losing my ever loving mind here because I'm just like, oh my God, like finally so much is like clicking in place. Yes, Jason, I 1,000% understand that. But there are so few people like us who are excited to talk about our story and are excited that we've done something to save our life, because obesity is still seen by 99.9% of the world as a decision. So you do not want to out yourself as being this person that can't control what you eat, or you just can't work out enough, right? So you don't want to be public with it because you think it's a you thing.
Mhm.
It's not. It's not. This is a disease, right? That is brought on by biology, by genetics, by a million different things. And that was the question, Sarah, when you were talking earlier, I was kicking around in my brain. I was like, well, why are people so resistant to peer support? Because all four of us we talked to hundreds of people every single day. And the most common thing that we hear from people is, oh, I'm just struggling and I don't know what to do. And our answer always is, have you attended a support group in BariNation? Have you gone to a class, or have you attended your support group? Like there's so much fear that surrounds this peer support. And I think I just like cracked the code for myself. Like, oh, it's because you think that this is a you problem and, and not a disease problem. So you're going to solve it on your own because, this is all about you.
Well, I mean, for those of us that are American, we've been told to pull ourselves up by the bootstraps.
Mm-hmm.
For however many years you've been alive, that has been the message that you've received. It mirrors the disease of addiction, or the response to the disease of addiction, like so closely. It's like, well, why are you eating the cupcake? It's like, why did you chose to use that drug? You chose to eat the cupcake. You chose to, it's that
Mm-hmm.
choice decision there. When, if you've ever really paid attention, most obese people do not eat that differently than people who are not obese.
Mm-hmm.
And I know Jason, I've heard Jason, because he does talk about me sometimes, but on here, but I know, like before he was talking about, one of the ways that the way that I ate, which, and I will say all day long, I ate large portions. I did eat large portions, but I ate very healthily, especially because I have PCOS. They took my carbs away a long time ago, and so I was like, meat, vegetables, and he'll joke like, I liked healthy food. I didn't eat fried things. I didn't eat a lot of that. I still weighed 400 pounds. I consistently gained like 10 pounds a year for 20 years, regardless of diet, exercise, meal plan, whatever, because it had to do with my metabolic issues, that I had. But if anybody on the street would have said, put down the cupcake, go to the gym,
Mm-hmm.
and I think that's the fear that keeps people from getting out there and connecting. They're so terrified that we're going to tell them there's something wrong with them, or
And I think
just do it whatever way.
And I think that's what's so powerful, going back to people asking why we share our stories. And it's because we need to tell people, and we say this all the time, we need to destigmatize bariatric surgery.
Mm-hmm.
But we need to tell people that they're not alone, that is so common for millions of Americans alone. I mean, I'm not even counting the rest of the world, but millions of Americans every year struggle with obesity. And as I was listening to you, Sarah, and you, April, it's like, I remember being, 16 with my lap band thinking, I'm the weirdest person. Like, no one in my life, I didn't know anyone who had bariatric surgery, not one single person. So I thought I was just this weird, like random person that had such a unique experience. Yes, my experience was unique for me, but I didn't know that there were people out there who had the same struggles as me until I was 27 years old found the Instagram community and decided to take the steps to bariatric surgery. But when you're in that dark place of not knowing anyone, that is where it gets scary and frustrating and isolating.
Extremely, extremely. Are there other reasons, Sarah, that you think or research has shown that people resist peer support? Are there other factors that play into it, or is it just really kind of a fear-based decision?
I mean, I think there's definitely, the stigma around it. And then also just maybe a lack of understanding of like what it is or what it does. There is tons of research out there. I would just Google it. Value of peers, the power in peers, peer support outcomes, like just any of those, just general Google searches, you're going to get a lot of data. Because like I said, it has been around for so many years. It's just in different fields. But the thing is, it's that connection and that shared, experience, that knowing that you're not alone, and that it's the uniqueness also of everyone's pathway. So I think one thing that's really, really important, and we were actually talking about this in my BariNation support group right before this, is when you share your experience, you're sharing it from a perspective that it's not the way, it's a way. Because each of us have a different combination, right, of things that work for us. And so, we were, quoting, all our BariNationisms in there. It's what they're turning into, but it's kind of like, what's the best vitamin? The vitamin you take every day. What's the best journal? The journal that you use. What's the best tracker? The tracker that you use. And it's not going to be the same for everyone. This is not a prescriptive process. It's a very, very individualized process. But being in a space where you've seen other people go through the same struggles and challenges and coming out on the other side, well, that's going to increase my self-esteem and my self-confidence, because I'm like, oh, April was sharing about this and she got through it and she was able to come out on the other side. That's going to lift me up and give me the idea that I can do that too. Like your kind of conquering regain post, like where you got into Wonderland finally after 4 years. Like that was hugely inspirational for me, because with my life being as crazy as it is right now with work and BariNation and internship, I'm experiencing regain. And it's kind of funny because it's sort of on the same timeline when you started experiencing regain. But like when you made that post the other day, that just almost reinforced like, okay, I'm graduating in 3 weeks. I'm going to be able to get back on track. I'm going to be able to get this weight off. I'm going to be able to get back in line with my goal, which is, the same thing. It's like just getting below 200. That's, really what I would, what would be happy with. And so seeing that is motivation for me. That's empowering for me. And it's not that it's just empowering for me. Like there's actually data that shows peer support raises empowerment scores on people that have used reliable, validated survey instruments and conducted this research. So that data is out there. Definitely it increases that sense of hope and inspiration in people, feelings of empathy and feelings of acceptance. I know you guys have talked about that, a lot. A couple things that are great that, I wish more surgeons would understand, so they would refer more people to BariNation, but there's actually evidence out there that it increases like what they would call treatment response or treatment compliance. Like people do better on their journeys of, mental health addiction. Again, it's multiple fields, when they are engaged in peer support. So it really helps reinforce what our surgeons, prescribers, doctors, whatever, are trying to get us to go out there and figure out how to do on our own. They could actually be referring us to, programs like BariNation, where you can connect with somebody else that will walk along the journey with you. Like, you're more likely to get there with somebody else. So, and I'm a quote person, I should know whose quote this is, but I don't. But I don't know. Somebody will look it up and put it in the comments. But, they say, like, if you want to go fast, go alone. If you want to go far, go together.
Well, it's kind of like if you were to start a new job or start a new school and you had a friend that already worked there or went to that school, you're going to seek that friend out to learn the rope, because that friend has already kind of carved in their own path into wherever that is. Because peer support is the same thing. You're just finding somebody that's already got the map to where you want to go, and you just, follow along in the journey, and they're going to help you get there. They're going to tell you where the pitfalls are. They're going to tell you, don't go down this road, go down this road. They're going to tell you to avoid this, do this. To the people that are struggling to reach out for that support, I would just legitimately say, just like with the surgery, there's a better way to recover, just like there's a better way to actually have the surgery and be, in a better situation than we were pre-op. It's the same thing. Like, if you are struggling in the journey and you need people to not only understand you in a non-judgmental way, peer support is the only way you're going to find it. Because if you reach out to somebody who's never had the surgery, they're not going to know that a majority of people do this. They're just going to say, oh, well, I told you you'd gain all your weight back. I told you were going to struggle. I told you this shit was going to be hard. Like, oh, yeah, you thought it was just super easy. And you get to a point where when you get into the community of people that have been there with you, the empathetic side of things versus the sympathetic side of things, the empathy people know, because we've been there, we've struggled. I don't know anybody who's just jumped on the opposite side of post-op and just been like, oh, nope, never had a problem. Cool. I'm 20 years post-op, never had an issue. Everybody's experienced a stall, a regain, or something of some sort. And they're going to understand, and they're going to not only be able to tell you not only what they went through, how they felt, so that you're not the only person in the world feeling this, but they're also going to be able to give you some input on how they got past whatever the roadblock is you're looking at. So it's not so much, it's not so much the hand out, it's the hand up. It's somebody that's going to, take you along by the hand and say, hey, this is what we did. This is how we do this. This is how things work here. And you just kind of move along that way. So for the people that are resistant, I would just say, at least give it a chance.
And I don't necessarily know that anybody's really resistant. They're probably afraid, or they don't know how it can benefit them.
Well, and that requires kind of the same amount of strength and faith that we had tapped into when we made the decision to have bariatric surgery in the first place. I mean, you guys know I've talked about this with you. I'm not a religious person, did not understand faith until I actually had bariatric surgery. I get it now. And it's terrifying for somebody that wasn't brought up with this as just being a concept that is, taught and learned. You have to have a lot of faith and just believe that something better for you is waiting on the other side. And it's so hard to believe that something better is waiting for you on the other side of that Zoom link. But it's true. It's true. And the impact is huge. Now, I know there was something you wanted to say too.
Oh, yeah. I just wanted to circle back to the sympathy versus empathy portion. I watched a video by Brene Brown, one of our favorite people here in BariNation. And it was about empathy versus sympathy. And empathy is just what Jason was describing. Empathy leads with emotion and experience. I know what April and Jason and Sarah have gone through to a point. Whereas, my mom can sympathize. I say, I'm really struggling with regain and I'm trying to get it back off, but I'm just really struggling to get this regain off. Oh, well, that sucks. Like, have you tried going to your doctor? Like, Yes, I have. Like
Mhm.
I just wanted to come for some empathy, but you gave me sympathy.
Yeah.
And it's nothing ill towards my mom or to anyone else in that support circle.
Mhm.
But when you get to the deeper level that Jason was talking about, where I can go to April, Jason, and Sarah and say, "Oh, I'm really struggling with this regain. I've gone to my doctor. I've done these things." They'll say, "Oh, well, have you tried this? This is what
Mhm.
I did, and I lost the last 20 pounds."
Mhm.
No, I would have never thought of that. And then I have a partner with me to go on that path with. And that's
Mhm.
the difference between that sympathy and that empathy.
Yep.
And you find that empathy within peer support.
Yep.
Yep.
And never in a million years would I have thought that my OG girlfriends, right? My closest girlfriends they've been with me basically my entire life. We never talked about weight ever. We never talked about weight. We never talked about cravings or the struggles that we were having when it came to nutrition and food and our body and size and shape. We didn't talk about those things. But as soon as I started sharing my story, right, just on Instagram, they were all watching and listening without me really even knowing it. And what I discovered is that even though my girlfriends, I wouldn't say are suffering from the disease of obesity, right? Like, it's not that. But when they heard me talk about what I was struggling with, every single one of them picked up the phone and called me and said, "Hey, you won't believe this, but I think the same thing too." Like, I was like, what? What do you mean you think the same thing? It opened up this new dimension to our friendship that I just thought was off limits, because obesity, again, is such an isolating disease, and I'm the only one that looks like this, and I'm the only one that's overweight. And so you just think like, well, I could not believe how similar we actually were. So sometimes when we are brave enough to kind of share our story, we realize there are people in our lives who can empathize with us in ways that we didn't know. But if we didn't share the story, if we didn't have these conversations, I just would have never known that.
Yeah.
And the other really positive thing that has come out of peer support for me is I realize and I think we're all kind of this way. We look to the experts to like learn some things, but we are a little bit fearful or judgmental of advice or information that's coming from somebody who hasn't lived it.
Mhm.
I don't know about you guys, but none of my medical providers ever appeared obese. Nobody ever said anything to me about bariatric surgery. Other professionals that I'd worked with had just not struggled in that area. So when they told me to do things or try things, my brain instantly was like, well, how would you know? Like, you're not fat, you're not obese, like you don't know. So I just don't want to hear it from them, because I have already thought they don't get it, which is not a great mindset on my part. But what I have found, the power of peer support for me, is that I hear and I listen on a different level to people in our own community. And I have been able to make that switch because I am learning and listening and growing from experts, let's say in the BariNation community, and they've never had surgery. They acknowledge obesity is not something that they struggle with, but for whatever reason, I can hear it from them. I can hear it differently. I'm going to take in that information because, it's like if my parents told me something, yeah, okay, whatever. But if a peer tells it to me, I hear it differently. I hear it more deeply. It impacts me differently. And it's information that I can take and use in a different way. It's not mom and dad telling me what I should do. It's friends, it's peers offering a menu that I can choose from.
Well, and
Way
we're also
different.
fortunate. We're fortunate to have a lot of the experts, even the ones that haven't been on our side of the knife, that lead with that. They let you know that, but they also let you know that they advocate for us in many different ways in the obesity community, and say, it's different when they lead and say, well, I've studied this and I understand this about obesity, because they come at it from an understanding point where the other felt like a judgment point from somebody who's on the outside looking in, just going, just try this. Go walk on the treadmill and fucking eat some salad. You'll be fine. And, you don't look at it the same way when somebody comes to you with compassion and says, hey, listen, This is where I'm coming from. While I have never struggled with it, I've dedicated my life to studying this, and I understand this because of this. When it's brought to you in that way, it breaks down most of the walls. You may still have a little bit where you're going, I'm going to make sure that this is on the level. But at the same time, like you will hear it and be a lot more receptive to it when it comes in a nicer package, so to speak.
Oh yeah. The golden words to my heart is when surgeons or dietitians or, anybody in our world starts off by saying, I've never had surgery. Either I have or I have not struggled with my weight, but here's what I've learned from my patients. Here's what I've learned from my clients. Here's what I've learned from other bariatric patients. Thank you, because you are now putting the patient expertise in a realm that I can understand. So you are acknowledging my existence as a human, and you're also acknowledging my experience and existence as an expert in the disease of obesity, because I am a patient expert. So right away, I'm like, oh, okay, you get it. Thank you.
Because we came from check cashers. That's why, because my surgeon, your surgeon, they were just, it was pill mills. It was, they were cashing the checks. As long as they got the checks cashed, good to go. I'm out on the other side. So to hear somebody that actually takes our stories and our struggles into account, it's huge.
Yeah.
Well, and I think too is, they're like this, the surgeons that don't interact with patients, or, that even dietitians or whatever that don't interact with patients, to see all of our uniqueness or how our life is happening along this journey. They just go to this basic, like the data, the statistics, right? You had surgery on this date. By this date, we expect, right? How many people got those expectations? We expect you to have lost XYZ amount of pounds. And they don't understand the weight that expectation carries. Us as patients. And so then we get into, like, in my transfer addiction group, we talk about like our food mood cycle, right? So, like we have this feeling or the support, we solve it, something, by turning to food, which then creates shame and guilt, which then like just gets us on this cycle that continues to go around. And so I think since they have never experienced it, they don't understand what it does when they give us these expectations. They're not really goals or parameters, but we will hear that word, expect. And I feel like that does something completely different to our brains as bariatric patients. And I think the place where peers are so valuable in this journey is because our job, our role, right, is to come alongside that individual and to assist them in finding and following their own path, without the judgment, without the expectation, without the rules, without the requirements. Like, in my group all the time, I'm like, we're about making informed decisions. So that's it. I'm not going to tell you what you have to eat. I'm not going to tell you what you have to track. I'm not going to tell you what you have to, like, nobody does that. And in any of the support groups that I go to in BariNation, it's always like, what do you think? What works best for you? The stuff like that. April, I've heard you say a million times, there's no such thing as a bad bariatric patient. There's no such thing as bad foods. Right? It's taking in the information, taking the data, and making our own choices with what works best for us. And peers are that person that help you do that. They support you in that process. They almost shield a lot of that negativity, right? Where it comes in like, oh, you ate a cracker? You ate pizza? Oh, you can't eat pasta. You're a bariatric patient. Like, no, you can't eat that. Remember the dreaded Twix bar in Ohio that fell out of your bag? Like, it's like you would have thought a pin drop. April from BariNation has a Twix bar. There's no such thing as like this contraband. You're like, yeah, it's a Twix and I'm a real person. And, I was on a plane for however many hours.
Dude, that was like a highlight of my bariatric life. When that Twix bar fell out, Casey, who I love and adore, I'm like close friend with Casey now. I remember she bent over and she picked it, and as she was picking it up, she's like, "Oh, your dive bar," and realized it was a Twix bar. And the sheer panic on her face when she realized that she might have just outed me. I mean, she was like paralyzed with fear. And I just remember I picked it up from her and I held it up high for everybody. And I was like, "It's a Twix bar. It's a Twix bar. We don't need to panic. It's a Twix bar."
I mean, I remember too, also in Ohio at Danielle's wonderful Renew event. That was when I feel like my bariatric life really started because of the peer support that we gained. Mm-hmm. I was talking to someone, we were at this little tiny dive bar in Ohio, and someone said like, "Oh my gosh, I'm so glad my surgeon can't see me right now." And I remember being like, why? Like, you're happy, you're with your bariatric friends, like we're having a good time. Like, why wouldn't you want them to see you? And she goes, "Well, I'm just being she literally said, I'm being such a bad bariatric patient." And I mean, to your point, Sarah, I literally was like, "Say that again." Like, I was like, "You are not a bad bariatric patient." It's like 1 a.m. and I'm just like, I want you to get this out of your head because no one is a bad bariatric patient. Yeah. But that is the power of peer support. It's that we can, and April said this at the top, we can call each other out. And I can say, "April, that may not be aligned to your bariatric goals right now." Or I can say, if she says, "I should have eaten this." No, you chose to eat that. That's fine. And eliminating, or like you said, Sarah, shielding each other from that negativity is something that I never really knew that I needed until I had it. I didn't realize how negative the world was to me about my bariatric surgery until I had peers to shield me from that negativity.
Well, or how much of it has rubbed off. Like we picked it up and didn't even know it. And we're just ready to just hang ourselves out to dry and, tell on ourselves and to ourselves and talk about how horrible we are when we didn't have to, because we just assumed that's how it was going to be. Same thing with the expectations from the surgeon. Like, if you don't hit that, then all of a sudden you're a horrible patient. You suck. You can't do that. You can't even do this right. Just another way I've let myself down. Here we go again. Rah, rah, rah. All the shit that we tell ourselves that's completely not true. But that's what we have the data for, because every diet we've done, every cleanse we've done, everything we've tried to do, whether it was drink water and eat a crouton for a week, whatever it is it may be, we tried to do to lose 5 pounds and weren't able to do it. That's automatically what we go back to. But, it's such a more positive space when you don't do that anymore. When you learn the freedom of not doing that to yourself anymore, you will be super excited that you found that space, because it's like losing the weight all over again. You don't have to carry that backpack of burden of thinking that, that shit gets heavy. Like, put it down, because it's not yours to carry.
Yep. Well, and we talk about this, we talk about this often. We just get so down on ourselves anyways. And I think that's why the word expectation can be really heavy for us, because we've heard this a million times from ourselves or from other people. So when our bariatric surgeon's like, "Well, we expect you to do X, Y, Z." And it's like, cool. So did Weight Watchers, Jenny Craig, 30, 10, Atkins, go down the running list of expectations. And now I'm just right back in there. But that shielding of the negativity is so important. And I'm so appreciative of these conversations, but in just being okay with things being more positive. It's not toxic positivity. This is realistic positivity, right? We, all 4 of us, have had very difficult, hard, deep, dark, conversations that did not end with positivity, right? Sometimes those conversations just end with, "Oh, wow. Oh, okay. Thank you for sharing. I'm sorry." It's not that everything becomes positive, but that experience becomes a more positive experience than you've ever had in the past. And that glimmer of hope is what allows us to continue to connect with our peers when things get difficult, heavy, hard. because that does not change after surgery. Life is still hard. Bad things still happen. We are going to stall, stumble, fall, slip, fall down the ring, like all the things. It doesn't change. But that interaction that we can have with the peer can change the trajectory of where we're going.
Well, because there's always revelations, whether or not it ends up positive or not, you always reveal something that you didn't, that you were digging for anyway. They just helped you. They just gave you the shovel to find it. Like, you may sit there and be digging through the sand with your hands. Somebody hands you a shovel and was like, here, dig a little bit deeper. Boom, you find it. So it's revelatory. So it may not, like I said, it may not always be something that you have to, end on this super positive, everybody sing Hare Krishna and, make s'mores and all this shit around a campfire. But at the same time, you still get to the revelation that you didn't, you may not even know you were looking for.
Yeah.
Oh yeah.
Well, and I think too, it's not even about, definitely not about like toxic positivity, but I'll go back to Nat's example that she was using earlier about, like going to different people and sharing about like she's struggling with like regain, as an example. But I think one of the things is as, bariatric patients, when we're in that space with somebody and we've also felt that feeling, we can be just like, yeah, it sucks. And it's hard. And sit with them in that feeling for a minute. And then just say, and it's not about like, yay, Raw, you're awesome. But it's saying, Nat, I know you're going to figure this out because you're looking for the answers. You're talking about this. I believe, I know you're going to get it figured out. And giving them that little, like, not, like, oh, everything's perfect, but it gives them that boost or lifts them up just a little bit to continue on their journey, right? We're just giving you a little boost up. Like Jason said, it's just a little hand up.
And I think it's also, I've learned to say, like, yeah, that sucks. I've been there and it's hard. And then saying, how can I support you? How can I support you right now? And I've said that to April before. And I've just said, how can I support you? Because
we've been saying that a lot this last couple of weeks to each other. We've all been there.
To each other. Absolutely. And it's not about that toxic positivity of like, we're going to get through this and it's going to be great. And it's going to like, rah, we're going to lose those 20 pounds. Like, no, this sucks. The space that we are in right now is hard and sticky and gross. How can I support you right now? And sometimes like, we don't even have answers. We're like, I don't know, but just talking about it helps. Like, and that's enough. But just saying to your peer that you are there to support them in this really gross, horrible moment is enough. And that's the positivity that April was talking about earlier.
Yeah. Well, and what just dawned on me too is I'm like, seriously, this conversation is just like, oh my God. I wonder if some people are worried or resistant about peer support because deep down, they know they're not ready for a solution yet. They just want a safe place to kind of like, move it out. Yeah. And I think sometimes we work, because even I think that too. I mean, Grady can tell you, I lead now, I go into, Jason, I love, because you know what I'm going to say. I will go into conversations with Grady and I'm like, listen here. I just don't say a goddamn word. Just listen. Just listen. I don't want a solution, an answer, a problem solved. Nope. I just want you to hear what I'm struggling with. And I've learned in my 13 or 12 years of marriage that, I have to leave with that sometimes. And I even have to, ask people, are you sharing this with me because you would like to help me problem solve? Or are you sharing this with me because you would like me just to be present or, to be a witness to what you're going through? And once I've been able to distinguish that, it's been mind-blowing for my relationships. But I wonder if that's why people also are hesitant about peer support, because they're like, I'm not ready for a solution. I just need a safe spot to land.
Like you don't want you to fix it. And I think that especially if you don't really understand what it is, I think that could be a very scary, place to be in. You know, and I think the important thing about peer support is it's a combination of like experience, but you're also dispelling myths and kind of like providing education as well. So, you know, just saying like, yeah, my job's not to tell you how to fix all your problems. That's not what I do. But I think back, and this was probably like the most impactful VBM that I've ever been to. And it's hilarious because it was February of 2022. So it's been over a year since I've attended this VBM. But it was when Dr. Russo was there, and he was talking about the way that you calculate like your expected weight loss after surgery. And he, you know, after the VBM was over, he stayed on and taught those of us that were there live, like how to calculate it ourselves. And that was so huge for me because my surgeon allowed me to just kind of pick my goal weight, which was like 100. And my initial goal weight was like 170 pounds. I weighed 391 when I had surgery. And I expected to get there in a year, you know, like that was what I was supposed to do. And so, you know, I remember sitting in that VBM and I was down almost like 140 pounds, like 9 months post-op, feeling like an absolute failure, not even really looking forward to or wanting to go to retreat, and terrified to say it out loud because I'd already lost more weight than most people because I was so heavy to begin with. And, you know, like he taught us how to do that. And so when he taught us how to do that and realized, well, like I'm already a successful bariatric patient, that then also gave me the voice to talk to my peers. And then when other people were like, oh my gosh, I know exactly how you were feeling. I feel like I'm failing too. Wait, how do you do that math again? And then, you know, like so many people were coming back like, wait, I am doing good. I am doing this. I am successful patient right now. But so it was like that combination of providing education, sharing, you know, like I thought I was a complete mess too. And then opening that door, giving them that space to do that. Because I think the other thing, like as patients, is we don't realize the way other people see us, like when they're looking in. And that's one thing, everybody that I work with, I always like, that would be my gift. If I could give that to the people in the world, is the ability to see themselves through other people's eyes.
Mm-hmm. I wish that for myself many times.
Mm-hmm.
Yeah.
I mean, I wish it for everybody. But I think it's like until we're, you know, like when we're willing to share our hard, you know, or those moments of self-doubt and things like that, that's what opens that door for other people. So I think if you're interested in peer support or, you know, doing things like that, just like keep sharing your story, keep sharing, you know, how you're feeling that day. You know, and I this isn't my job, but it's just because I drank the BariNation Kool-Aid. But I mean, if you're interested in engaging in peer support, you could always come join us in BariNation.
Yep. Well, it's interesting. I wrote it down because I had another epiphany, right? And I think this is true for a lot of people. I think a lot of people think that they can't engage in any type of support until they have an idea of like what's wrong or like where they need help. But if you've already figured it out, then it's not too late, but you're missing the best entry point, which is to just acknowledge that something is wrong or acknowledge that you need help. That's when you really start. You don't have to know what's wrong. You don't have to know what's tripping you up. You just have to know something is not right. Like I'm struggling. That's the moment when you engage, because peer support will help you clearly identify the areas in which you are struggling. And your peers will also point you in the direction for help, whether it's peer-led, expert-led, or if it is one-on-one medical help that you need above and beyond, right, that peer support. Your peers are literally there to help.
And much like your wife, what you're struggling with could change too. What you may think you need peer support on to start with may not be what you wind up needing peer support on. Or actually, you may think you have nothing to offer other people and find out that you are a source of peer support for somebody else. It's an amazing thing to stumble on, especially early in those phases, because you may, you come in thinking one thing and you leave thinking something completely different on so many different levels that it's an amazing tool. I shared on my story a couple of days ago, I found a quote that I shared in 2014. It's something about the two most important days of your life are the day you're born and the reason you find out why. Well, in 2014, I had posted with the caption, I'm still waiting to see what the second part is, but I'm excited to find out. Fast forward now to 2023, this is exactly it. Like, I was foreshadowing exactly what's going on right now, because a lot of people, we see a lot of people in the community that are like, oh, well, I'm so far out, I'm going to change my page to a regular page now because I don't share a lot about my bariatric journey. And that's fine for people that don't really want to, make this their everyday part of their life. But I've chosen to dedicate the entire second, this second lease on life that I got to bringing other people along with me, because I was dying. So I know what it's like to be, looking at the end, and now, not knowing how much time I've got left. You damn right I'm going to dedicate every day that I've got to helping other people, no matter what that is. Peer support on every level that I can possibly offer, anything I can do, I'm going to do that. Because I had no real, I was kind of aimlessly wandering through. Like, I had my family, I was doing all the family things. But past that, I really didn't have, I didn't feel like I had a purpose I didn't fit anywhere as far as purpose goes. But knowing now, having that solidified and locked in is something I wake up for every single day. And it's an amazing feeling to know that today I get to help somebody else. There's one more person down the line that's going to need something, and I'm going to be there to be able to help them. Whereas before, by my doctor's words, I probably wouldn't be here sitting with you guys today had I not had the surgery. So the fact that I did, and now I'm able to offer that peer support to other people, is an amazing gift that I will never take for granted.
Yep. Well, and I think that's a perfect way to kind of wrap up our conversation, or to summarize our conversation. We have all experienced some pretty amazing things because of the power of peer support. Nat, what would you say is one of the most powerful things that you've gotten from peer support?
Man, one thing.
You know this is my favorite thing to do.
I know. I mean, I think it really is this right here. When I was gearing up to have my surgery, I was in the throes of my pre-op diet, which was not easy. It was probably one of the hardest things I've ever done. I had to lose 50 pounds in 3 months, and I did it on the dot. Somehow made it work, with the help of listening to April and Jason on, what was East to West at the time, listening to our Sleeve Life podcast with Kelly and Mel. And that was my form of peer support at the time. I didn't have a lot to contribute necessarily, but I was there and I sought it out, and it got me to my surgery, and beyond. But I just remember, putting in my headphones and walking at 5 in the morning, because I was in Arizona at the time and it was 80 degrees by 6 a.m. But that was my peer support. And it's only grown from there, but that's really, when I think of peer support, that's what I think of.
Yeah. Jason, what about you? What's the most powerful thing that peer support has given you?
It's given me family. It has given me friends that have legitimately turned from support into family that we fly across the country, last minute's notice to be with each other, to spend time with each other, major events with each other. We are a part of each other's lives to a point now where I never in a million years thought that I would have, because Sarah and I are fortunate to have a core group of friends that we've had since we were kids. And we're really like, we've had acquaintances and people, you know, that we get close to in other realms of life, but nothing the way that our Bari fam has come together for us. Because I know at the drop of a hat now, there are 10 people that I can pick up the phone and call any one of you guys, and you're going to pick up, except April, because you don't do that. But because you're much like Sarah, you two have a very expensive paperweight on your desk that you just pay, you know, all this money for every month and don't answer. So, but I know eventually you're going to get back to me, and that's what matters.
Can't you just like kick him out of the Zoom?
Yes, yes. Uh-huh.
But no,
Exited.
The family and the support and the community that this peer support has given me on a just, you know, there's our core group of people that we know and love, we, you know, are dearly would do anything for. But beyond that, there's so many more people now that we can say globally support what we do and allow us to support them in a way that I never thought was going to ever happen. Like I told somebody the other day, I still have every graphic for every 100 followers we attained on Instagram starting at 100. And I still remember where we were every time that 100 clicked to 2 to 3 to 4. And I remember getting so excited and telling Sarah, oh my God, it's gone up. Like, oh yeah. I was super excited. And now to look at the fact that we can legitimately say there are people around the world that we help and support is something that I'm extremely proud of, because like I said, with that, not knowing what that second part of my life was going to be dedicated to, knowing that not only can I reach people in my immediate vicinity, but knowing that I can reach people far and wide that I never thought I would, you know, there's places I never even knew existed that we support now.
Yeah.
And that's amazing to me, because the power, exactly the title of this, the power of peer support, the fact that you can reach people around the world that don't have support, and you can be that voice like we were for Natalie, like we've been for so many other people. There's just like, that's infinite amount of power, like that you can do and give and create for people, like knowing that people get up every day and say, I can do one more day because I have people that support me. I can make it till bedtime, like Nat used to say, because there are people that will get me there. There is a group, there's a community, there's a live, there's just people there that will do that for me, you know, that will help me get there. I just have to be willing to reach out and do that, because that's how all of this started. The strength and the power it takes to click a Zoom link just to show up somewhere, not knowing what's on the other side. It's nerve-wracking. It is hard. But had I not have done that, all of with April the first time, who knows, how long it would have taken us to get this, or even if it would have happened at all. So not only can we do hard things, beautiful things can come out of those hard things that we do.
Oh, absolutely. Peer support really has given you a lot of purpose, Jason, right? It's a lot of purpose. And I know that you would not be as successful as you have been without that, right? Like it goes two ways, right? That purpose feeds you, but that purpose feeds you in the other way, right? Yeah.
Yeah.
Sarah, what would you say?
Absolutely.
Yeah.
For me, I'm going to say acceptance and inspiration. So I think those of you that, that know me, I have always felt sort of othered. One is because I'm multiracial, so I don't really fit in any of the boxes anywhere. But there's something very interesting about making a statement and like expecting to have to explain all the nuances and just having somebody else go, oh yeah, I remember that. and it kind of like throws you off because you're like, wait, what? You know what this is? You know, and of course, like my recovery community organization experience, you know, it started out talking about, you know, addiction, recovery from addiction and things like that. But then I never remember, like the very first retreat, I met Casey, and somehow we got on, you know, the diet mantra, like the, you know, all of the 20 million diets that, you know, we've all been on. And I said something, and I mentioned the cabbage soup diet. And she was like, oh, that one was the worst. I remember that. And, you know, and started talking about it. And it was just kind of like this, we were like instantly kindred, because there was just that immediate acceptance. We, you know, were immediately transported that back to trying to have the Dolly Parton waist or whatever, you know, it was back in the 90s, and all the horrible, you know, thing, because you only ate like one food a day and it switched up, except you could eat like this cabbage soup stuff every day as much as you want. It's great diet. All the cabbage soup you want. But yeah, just like that connection where she immediately knew exactly what it was and all of the pieces to it. And then I think, you know, like the other time I remember at retreat, some like people wanted to take pictures with me, and I said, oh no, I'm not a person. Those were literally the words that came out of my mouth.
Wow.
What I was trying to say is I'm not like an influencer. When I went to retreat, I didn't even have 200 Instagram followers. Like I had like 100 people on my Instagram. I knew all of them in real life. Why do any of these people want to take any kind of pictures with me? I just was not, you know, like I was there to, you know, herd the cats.
Yeah, no, because you were their peer, because you were their friend, their peer.
Right. But I did not understand at all. But that was literally my response was like, I'm not a person. And they were like, oh my God, you know, like, and explain, you know, you were really not, you know, like you were really nice to me. You shared this stuff with me. I felt this connection with you. And, you know, I just want to have a picture to remember this weekend. Well, of course, oh my gosh, absolutely. Yes, we'll take the picture. But then realizing that, you know, I'm making that, it wasn't just other people saying that stuff that made me instantly connect and feel accepted by them. Like other people were having that same connection with me, and that it was going both ways. And that was just amazing. And then I think the other thing is just really, you know, inspiration, like I said, is like, you know, making connections with those people that came before me. I tell everybody, like, because you guys are all ahead of me on your journeys. Even Jason down there, like everybody's like, oh, how did she talk you into having surgery? And I'm like, yeah, really, I just went to do it myself. He talked himself into it, trying to talk me out of it. But yeah, he had surgery a year before me, and people just automatically assume because I'm the woman, I had surgery first. But you know, you guys have all inspired me in my journey because you share all of your struggles and have almost sort of paved the way for, you know, my process. It's almost like I kind of know what to look out for, or that it normalizes it when I experience it, because I've heard you guys share about that experience yourself. You know, like, yeah, April, your celebrations of, you know, making it to Wonderland at 199. I think a huge reason that I'm not stressing about this regain, other than, you know, it was like a blip on the radar, is because when you experienced this, you openly shared about it. And you know, when I first experienced regain, the regain, or realized I was even in regain, I think I probably had it for like a month or so before I even realized it was there, because I wasn't weighing either. It was that moment of like, but look at everything that's happening in your life right now. Like, when would you have time to focus on this? You know, like, oh yeah, I don't. I will in May. You know, and then it's kind of normalizing that, like, that, you know, it's data. It's not, I'm a bad patient. It's this is what's happening. This is why it's happening. And, like, what to do to fix this when you're ready. And we're just going to sit with it for 3 more months, which is now 3 more weeks. But I didn't have to beat myself up about it.
Mm-mm. It's such a powerful freedom that we can get when we connect with peers, right? Because we realize these little things like, oh, I don't have to do anything about this right now. Like nobody's expecting me to do anything. I don't have to put this expectation on myself. Like, I can just literally be here and it's going to be okay. And if you're not having those conversations, or if you're not seeing that kind of, mirrored, then you just wouldn't know that that's even something to consider. So, the power of peer support really comes into us doing the work of just keeping our eyes and our ears and our hearts open to what other people are experiencing and going through, right? Like, one of the most powerful aha moments in my bariatric journey was when I literally went on Instagram and I made a reel of me changing my weight, right? The amount of weight that I lost from a lower number to a higher number. Right. So I went from like 118, I'd lost 127 pounds or whatever it was. Oh, no, I've only lost 101 or 97. I don't even remember what it was at this point. And I posted that reel. And you would have thought I broke the damn internet with that one, act of almost defiance in a way. And what I have come to realize is, like, if I keep these things that are scary to me hidden in the dark, they are going to absolutely consume me. They are going to destroy me. But if I bring them out from the shadows and into the light so I can get a good look at it, it's not that scary at all. And I'm going to have a lot of people who are going to come to my aid and go, oh, I can help you with this. Or, oh, I've got an idea. Or, oh, yeah, I did that too. Oh, cool. So this isn't anything to be scared or ashamed of. This is just an experience that is to be expected along the bariatric journey. And if I can lower my own temperature, other people can do the same. And then we can look at it objectively and we can make a game plan. And if we choose to do something about it, so be it. And if we choose not to, so be it. Like,
you and Natalie did the same thing for me, because when I was telling you guys I was struggling, and I was like, I don't want to tell anybody, because what's it going to look like if we're out here doing these podcasts and doing all these events? But I'm struggling. And you're like, well, everybody else is struggling too. So how do you know that you're not going to help somebody else figure out how to get there on the other side? And the support's out there. All those things, because I literally had told myself, like, I'm not telling anybody shit. Like, ain't nobody gonna know that I'm having regain. Like, nobody's gonna know I'm struggling, because that and that's legit what I thought. But once I put it out there, it's the same thing. I had the flood of people supporting and everybody knowing and understanding, and also getting to see the the not only the shiny parts of that we put on Instagram, but also seeing the backside of things. Like, that's one of my favorite illustrations ever, is the shiny apple in the mirror, but the backside has it's all brown and jacked up, because that's legitimately, like, you've got to see all sides of this thing, or else you're not helping anybody. If you just go through and tiptoe through the tulips and say everything's rainbow and gumdrops, people are out there thinking, well, goddamn, am I the only one struggling? Like,
right?
Yeah.
Right. Well, and that's the other powerful piece of peer support, right? We can call each other on the bullshit, right? And we also know, your peers know when things are not well. And when you're in the right space, when you're in the right community, when you're surrounded by the right people, they can help you see that other side of what's going on in a loving way. And if you don't have that, you can't see behind you. Oof. Right? Oh my gosh.
I love this, and you guys telling that, because you're literally going through. I mean, I know we're all sharing personally what peer support did for us, but we're hitting all the roles of peers, right? So we've hit, like, inspiring hope. People can and do recover. We can do hard things. We do have these challenges. Walking with people along their journeys, right? We just went over that, like, how we've done this together. April, you were talking about the reel where you're, changed your weight up instead of down. That's dispelling that myth, right? Of, like, what it means to be a bariatric patient, what it means to have the disease of obesity. It's not, the scale's not always going to go like this, right? I'll see you do it all the time. You'll be like, it's all over the place. And then, like, providing self-help, education, linking people with tools and resources, like, and then supporting people in identifying their own goals. So it's like our goals, it's what we want for ourselves, it's our hopes, it's our dreams, it's helping us or helping each individual create their own map for how they're going to get there, right? And it's funny that you were so blown away by experience, strength, and hope in the very beginning. It's all there. Like when you talk about it and tell the story, like all these pieces are there. And so I just love that you came, like we came back at the end and we were just like, oh, boom, here's all the pieces, all the things that peers do, they've actually done in our lives.
Yeah. It's always magical to me, you know, when we're working together as BariNation, right? Building the support that we know we need as patients, whether it's podcast, BBM, the community, Instagram, whatever, right? Wherever we go, we go as BariNation. And without really understanding what we were doing, without really having a model, we have been able to create something so meaningful and so powerful by just believing in ourselves. And by just saying, I think I need this, I think this will help, and then creating it and making adjustments as we go. But it's because we're relying on our peers to offer that feedback and to provide that mirror and to provide that hope and to share those stories, right? We are creating what we need, right? And it's just our hope that everybody accesses this type of support, because we are successful because of it. We're successful because we participate in it, and we're successful because we're building what we need. And I think that is that's the biggest power for me, is that it's a space for me to get what I need, and it's a space for me to create what I need. And that's pretty amazing. Well, as always, this conversation has left me baffled, befuddled, brain broke. All the things. And every time we go into a conversation with you, Sarah, I'm like, I'm pretty sure I've heard it all, but maybe not. And then every time I'm like, oh, wow, I've heard none of this. Sarah, my friend, where can people follow and find you if they would like to connect with you?
So every Monday night at 7 p.m., you can find me in the Transfer Addiction Support Group inside BariNation.
Imagine that. And it's phenomenal.
Great.
It's phenomenal.
But,
I just need to say.
But other than that, I am Bari.grateful on Instagram. I have not been very active on my Instagram the last several months. I usually do post a motivational, inspirational thing or quote every morning, but that's really about, honestly, all I've been doing on Instagram. And it's because I am in an internship where I completed on May 5th. I will graduate with my second master's degree. Woo! But I will be back on Instagram after that, engaging with the community. So it's at Bari.grateful.
Yep. And you can also connect with Sarah in the BariNation community. She does lead an amazing addiction transfer support group for us that is very warm, very welcoming, non-judgmental, very inclusive. And you can connect with her in the community as well. We should probably do this. Nat, where can people connect with you if they want to do so?
I'm kind of all over the internet, it feels like. You can catch me on Instagram, and my personal Instagram at Breaking Bari, like bariatric _ERS. So at Breaking Barriers. I'm also usually the person behind the BariNation Instagram. So that's at Bari.nation. The dot is very important, so please use it. And then I'm also in the BariNation community. I have taken it upon myself to attend as many support groups as I can for my own peer support. So you'll catch me in some random groups there. I also lead a pre-op and beginner post-op group every Wednesday at what time? 6 p.m. Pacific time. And it's a great place if you are pre-op thinking about surgery, you just had surgery and are looking for support. I don't have to do like any work because everyone does the peer supporting, and I just monitor it and make sure it's like on topic. It's a pretty awesome group. So yeah.
And that group is that it's a meetup and it's fire. And I think a really important distinction to make here is that if you are new to the BariNation community, we have three very distinct types of support. We have support groups that are only led by licensed therapists. Many of them are patients themselves. They are never recorded, and we work very hard to maintain confidentiality for our members. So support group equals therapist led. A meetup is a more casual peer-to-peer support opportunity that is hosted by one of our patient moderators, or Jason, Natalie, or myself. So casual, not right, clinical expert, patient expert that leads it. And then we have classes that are very educational in nature. Come prepared to learn something, take notes, gather new information. And they are led by experts in our community on topics that are meaningful for us. So like a couple of weeks ago, Jeannie Boyer, registered dietitian, led an awesome class on like how to read nutritional labels. It was phenomenal. Rodolfo always has amazing classes that he's teaching on mindfulness, on anxiety management, all kinds of things. So three very distinct types of support for three very kind of different reasons. So I just want to make sure that everybody knows we have a variety of ways that we can connect. Yeah. Jason, my friend, where can people find and follow you?
On Instagram, I am the THA_Smithsonian_, not the Smithsonian, because that's the museum and they don't like it when I use their name. So I had to switch it up a little bit. On TikTok, I'm actually the Smithsonian, no underscores, no any of that. Starting to get a little more active over there. You can also find me in the BariNation community. I lead a class on Saturdays called Space and Grace with Jason, where you can come in and just hang out and talk about things that you may need a little space and grace on, whether it be victories, whether it be struggles, whatever that may be. You can also find us at on YouTube at BariNation, where you can also watch all of the other podcast VBMs, things that we have on there. And yeah, that's about it.
Yeah. You can find me on Instagram at actively_April, or also at Bari.Nation. And I too lead meetups in BariNation. Mine are a little bit more sporadic, but my favorite things to lead are our Set It Up Sunday meetups, which is where we gather as a community to plan out our week ahead. It's just dedicated space to do that. I also lead a lot of our new member welcomes, and I'm oftentimes going live in the BariNation membership community, because if you guys know me, I love to just share, and I do a lot of that in there as well. So lots of places to connect there. Sarah, do you have any parting words that you would like to leave our listeners or watchers with?
I think the only thing that I will say is that because my story is a little bit different, peer support has always been a huge part of my journey and of my life. And it's always been there for me, like no matter what. And because of that, that is what has enabled me to be able to help others. So I'm going to encourage, challenge, whatever, people, if you are unsure about what it is, or whatever that fear or that thing is that's been holding you back, just give it a shot. Give yourself a specific amount of time. Use that data collection model that I love so much, and see if it has an impact in your life, because I really truly believe that it will.
We echo your belief. Sarah, thank you so much for joining us tonight. Our conversations with you are always meaningful, impactful, and always change the way that we think about our world and how we interact with others. So thank you for your time.
Thank you all for having me.
Jason, my friend, you want to take us out?
Yes, ma'am. Yes, babe. Thank you so much for joining us and cutting out time out of your busy schedule, your super busy schedule. We know you got a lot going on, but we appreciate your time. Also, thank you to everybody that follows us, that likes, that shares, that subscribes, that tells people that we exist, because, letting other people know that support is out there and that people are out there ready to listen is super important. That's what tonight's conversation has been all about. But, you guys supporting us in that way is monumental to our journeys, as well as us being able to support you guys. You guys refill our cup daily, and we cannot thank you enough, because we wouldn't be here without you guys. So we appreciate you wholeheartedly. Don't forget to continue to tell people to follow us on Instagram, as well as YouTube, as well as liking, sharing, and subscribing. And the Anchor app, or what used to be the Anchor app, which is now the Spotify app, you can still leave us voice messages that we can incorporate in future episodes of the podcast so that we can help to just find another way to spotlight you guys. We appreciate that and the support we've got there as well. And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time.
Awesome. Bye, friends.
Bye, everybody.